He didn't eat street food, he didn't eat meat, he didn't eat anything expired, he ate a salad. Fresh, green, washed at home, the kind of meal people choose when they're trying to be healthy. Nothing tasted wrong, nothing smelled off, no warning at all. But inside that salad was something invisible, something alive. And once it entered his body, it didn't stay where food is supposed to go. It started moving. Days later, the headache began. Not a sharp pain, not a migraine, just pressure, like his skull was slowly filling from the inside. Painkillers didn't help, sleep didn't help. And each morning it felt worse. Then came nausea, light sensitivity, confusion. He struggled to focus. Words didn't come out right. Simple tasks felt heavy, like his brain was working through mud. By the time he reached the hospital, doctors were already concerned, but not alarmed. At first, blood tests came back mostly normal. CT scans didn't show bleeding. No tumor, no stroke. But the pain kept climbing. And then something appeared that changed everything. When doctors examined his spinal fluid, they noticed a massive immune response, specifically a surge in eosinophils. That's not what you see with bacteria, not what you see with viruses. It's what you see when the body is fighting a parasite. Suddenly, this wasn't a headache mystery anymore. This was a parasite case. The question was how. He hadn't traveled recently, hadn't eaten undercooked meat, hadn't touched anything obviously dangerous, until doctors asked one specific question. What raw foods have you eaten? The answer was simple. Salad. Here's what had actually happened. Certain parasites don't infect humans on purpose. Humans are accidental hosts. Angiostrongylis cantonensis, commonly known as rat lungworm, normally lives inside rats. Snails and slugs act as carriers, picking up the parasite from rat feces. When those snails crawl across vegetables, they leave behind microscopic larvae, sometimes inside their slime, sometimes clinging to the surface. You don't see them, you don't taste them, and rinsing alone doesn't always remove them. When those larvae are swallowed by a human, they don't mature the way they would in a rat. Instead, they get lost. They enter the bloodstream, travel through the body, and can end up in the brain. That's when the real damage begins. Not because they bite, not because they multiply, but because they exist where nothing alive should be. The immune system launches a full-scale attack. Inflammation spreads across the brain and spinal cord. Pressure builds. Nerves misfire. This condition is known as eosinophilic meningitis, and the symptoms are brutal. Explosive headaches, neck stiffness, nerve pain that feels electric, vision changes, tingling in the limbs, seizures in severe cases. Some patients lose the ability to walk temporarily. Others experience permanent nerve damage. A small number fall into comas. In rare cases, people die. Doctors can't simply kill the parasite right away. Destroying it too fast can make inflammation worse. Sometimes treatment focuses on controlling swelling and pain, while the body clears the larvae on its own. Recovery can take weeks, sometimes months, and sometimes full recovery never comes. That's the most disturbing part. This didn't come from spoiled food. It didn't come from negligence. It came from a meal people associate with health. This is why rat lungworm cases have appeared across the world, not just in tropical regions. Global produce distribution, raw food trends, minimal cooking. The risk is low, but the consequences are severe, and the danger is silent. No warning signs, no bad taste, no immediate reaction. Just a parasite that doesn't belong in the human brain, and a body trying desperately to fix a mistake it never meant to make. This is why raw vegetables must be washed thoroughly, why slugs and snails around gardens matter, and why sudden, severe headaches should never be ignored, especially when they come out of nowhere. If you experience intense head pain, neck stiffness, or neurological symptoms after eating raw produce, seek medical care immediately. And if you want more real infection stories, real parasites, real medical cases, subscribe. Because the most dangerous monsters aren't in the wild, they're already on the plate.